Nalisunga mashuine mumutima wandi ine mandi ndafira kwela nalisunga mashuine mumutima wandi ine mandi ndafira kwela yeyi wami wa mutima kukuleta walala wansikiza ngale yeyi wami wa mutima kukuleta walala wansikiza ngale Nena kumona minasena mumanongo ningo kushamananga Hey wami, wantwalangala Ilanga kumutimu nambaga kola Nambaga kulesha shidi kumutima Kokelu kile ila kuyekalate Hey wami Hey wami Yakufira jai na mutima wami Hey wami Oseza rubandi Amina kana nyanga kukuleta Yakufira jai na mutima wami Hey wami Oseza rubandi Amina kana nyanga kukuleta Mami wandi Nalisonga mashuine mumutima wandi Ine mandi Ndafira kwela Nalisonga mashuine mumutima wandi Ine mandi Ndafira kwela Imafuna kukamba Zonse Saku mutima Tikakumana Jebabusha ni wewe mwanafumu Nabadonsa tikakumana Nitangiwa kamba Ile yosenda na kumono mutima wanda Chilelo kangande Manifesto Imasola mukama Ndeshana kuipompa Ile pia masota That's right Numanga takumana Maulesi Hey wabi Hey wabi Hey wabi Hey wabi Yakufira jena mutima wami Hey wabi Osete rubandi Amina kana nyanga kukuleta Yakufira jena mutima wami Hey wabi Osete rubandi Amina kana nyanga kukuleta Mami wandi Nalisonga mashuine mumutima wandi Ine mandi Ndafira kwela Nalisonga mashuine mumutima wandi Ine mandi Ndafira kwela Yanjapo Aha Creator Yalo ate Create for corner Create for corner Create for corner Let's get it.
Good evening, Chuempala. Good evening, world. Good evening, Zambia. And good morning wherever you are. I believe Australia should be morning or in Zimbabwe. Otherwise, welcome to TVBAKWETU. My name is Elias Munshya, and I am here with Mr. Patrick Chilufya, and then he's going to come up in here shortly. And so today is Tuesday, the 29th of March, 2022, and there is a little bit of news that has gone on in Zambia. And as usual, on this flagship program, we always try to talk about the things that have gone on. If you are able to share with as many people as possible, subscribe to our channel, like our pages, and send us those stars and subscribe for a very small monthly fee. And we have a little bit of a discussion here, and so feel free to come and chip in. Ask questions, and let's hear your feedback here today. That is our login that I've just shared, and so we can talk a little bit together on all these issues. Mr. Patrick Chilufya, good evening.
Good evening, Munshya. Good to see you. How is the weather in Canada? Because the weather
It's
here is getting very friendly. It's like summer now.
Yeah, here it's also getting very friendly, and I think I'll do a run today. My last run was Sunday, so I skipped Monday. So today, Tuesday, I have to find a way. I already have my running gear panopen pa office. So now let's change off here. But you require some
Munshya,
courage. You require
Munshya,
some courage.
you've motivated me. So one of my, if we call it resolution, is to start walking a lot this year, and then
Yes.
from walking I'll start running.
Oh yes. That helps a lot. It makes a difference. Huh? Yeah, it really does
Because
make a
in
huge
terms of
difference.
ukulia, I eat very healthily, but then I need to start exercising.
Yeah. Oh yes, let's do that. And so the best app is Strava. I use Strava myself. That is the app that I use for my exercise. Yeah, it's pretty good.
I've got a watch, so maybe I can use that watch.
Okay, what is it, an Apple
I-
Watch?
It's an app. Yes, it's an Apple Watch.
Okay.
Yeah.
Oh yes, that works very well. So just get the Strava app and let's connect and let's exercise, Moiran. Let's exercise. Let's do this. It really
No,
makes a huge difference.
it's the way to go, Mamush.
When it comes to health, today it's Ministry of Health. The last time it was Ministry of Health, even today it's Ministry of Health. Lots of news that have come in from the Ministry of Health. When the list of 11,276, now I had written this on my Facebook, Jeberinomba Muchaushi, you see, 11,276, Muchaushi, it's very simple. Mi nitapendwa, 11,000 mi nitapendwa, because if we don't like ukuposenshita ukupende fintu ifingi. So 11,000 jobs from President Hakainde Hichilema for us. Mi nitapendwa ne mi nitapendwa. Okay. So we were very excited when there was that imi nitapendwa jobs, 11,276. But of course, it appears like the advert itself had a few problems. Ati ka advert kali kweteko tumafia tumo na mumfuako eridi ashibachirufia.
Yeah, but Mamusha, what I'm hearing now is that that is fake news. It's not correct. They are not going to re-advertise. That's the inform. Have you seen Jerome Kanika's Facebook page?
No, I haven't. Jerome, where are you? So
So
the
so
minister
Jerome
was
would
just
have been
saying.
here. Should have
So
been.
so, so the minister was just saying, could you watch advertise, but really not that they were re-advertised.
Did the minister say that? Did you hear the minister saying that?
Yes, the minister did mention that she might be open to re-advertising it. Now, I'm not sure whether she has given direction that it's going to be re-advertised, but she expressed willingness to re-advertise. And the reason I think is there are several health professions that went to have a meeting with her, and they were trying to make her understand a little bit more about the situation. And so that's when she answered back and said that we might re-advertise. But maybe that was not a complete picture. Maybe she's not given that directive. We don't know. But I wouldn't be surprised if it were re-advertised.
Yeah, but then Bamunsha, the opposition now, our propaganda machinery in the opposition, they are
Yeah.
saying, how come they advertised the jobs and then they say we might re-advertise, which means they don't know what they are doing. That's what the opposition is saying. But
Abo ba opposition, ushe ba opposition bakuposa kona mano. Ba opposition bale umva jealous. Pantu, the UPND has released 11,276 new jobs in 7 months. Now, this is not like a
Bamunsha,
take after 5 years.
this has never happened.
No.
I've followed Zambian politics, I don't know, maybe since 10 years. I've
Yeah.
never seen a government that employs so many people at the same time
Yeah.
like this.
So did we expect to cover it? There could be some hiccups. Of course, there could be
Of
some
course.
hiccups here and there, but 11,276 new jobs are there. And so a few hiccups here and there, and I believe that they are going to cure it and it's going to be resolved. In it, I only have my own concerns with the list, particularly when it comes to psychologists and counselors. That's my only concern. Otherwise, I think they will resolve all the issues, outstanding issues, and people should be able to apply. The only thing is, if you apply, do not lose faith at all. In fact, abantu number they are spoiled for choice. Imagine me, if it were me, imagine you have an option of applying from Lusaka, applying from Chwempala, applying from Milenge, and who knows, maybe applying from Solwezi. Who knows? So many options. And that's a good problem to have. You know, apply. So we expected to cover. There could be a few hiccups here and there, but at the end of the day, in Moneka, 11,276 new jobs have been created. Anyway, we're going to hear from some people who will give us an idea of what they think about the new 11,000 new jobs. 11,000 new jobs. So I think the minister was seeing several professions, Physiotherapists Association, Pharmacists Association of Zambia, and Clinic Officers Association of Zambia. I'm not too sure whether they had the representation from the Psychologists Association of Zambia, Psychology Association of Zambia. And so I'll explain a little bit about why I have some concerns about psychologists with the new advert. But anyway, we do have Mr. Jerome Kanika. Mr. Kanika, how are you? Pharmacist Kanika.
I'm very fine. But Patrick, how are you?
But Jerome, ishinshitosha iseshi. Kufile kwaba Black Friday in the next few days. Hello, man, says but Jerome, Black Friday, if you have Makuma says,
I'm inviting Munshya for Black Friday. It's this Friday, but it's this Friday, Patrick. It's not Black Friday.
Now, Munshya, there are two things I just need to state here on these jobs. But Jerome poverty and but Jerome talks Scriba Minister. But Jerome, you need to communicate this. I tried to communicate to my permanent secretary Mangwende, but it seems he's busy. I sent him a text. There are some, you know, Kuzambia Valishta introduced by Jerome. I don't know, you know that. They call them public nurses, public health nurses. And
community health. You're talking about community health nurses?
Yeah, they are community health nurses. It was introduced by Dr. Chitaluchilufia. And I think they started graduating 2-3 years ago. Yeah, so, and their jobs have been advertised, but most of them have discovered that their jobs are in the rural areas. So I don't know whether the ministry thought those jobs are supposed to be in the rural areas. So there are no jobs for very few in the urban areas. So if somebody is married in Kafiwe or in Lusaka, are they going to apply in Milenge or Chinsali or so? That's one thing, but Jerome, you need to raise.
Bachilufia, Jerome, no. Mr. Kanika is not our envoy. If you have something to talk, just go ahead and talk. But Kanika, we are not going to give him that burden of trying.
Okay. Yeah. So that's one thing, but Munshya, people are complaining that because the government has been talking about uniting families. So if all those people are trained, they are in thousands. Their jobs are all in the rural areas. How are they going to apply?
No. Actually, community health assistance, the position itself started from the rural areas, not from urban areas. It's not an urban area concept.
So which means...
Anyway, but Kanika, isn't that the case? Community health assistance.
Yeah. Actually, community health assistance, ngamne education. Pada pa kitwe ngamne pada pa parwangwa bridge paria. Paliba certain scope whatever trained community health assistants, and those were
no, these are nurses, public health. They are called public health nurses, registered public health nurses.
Okay, there are two things that we need to know here. We have those who have done public health just direct as a degree, and we have done we have also those who have done maybe something with public health.
It's a diploma. No, it's a nursing, public health nurses. It's a diploma.
Public health.
I think what we'll do, Bachilufia, is go and review this information a little bit more. Otherwise, to allow misguided. Because public health, I don't know which ones you're talking about. The field of public health is a field on its own, right? About the public health, they are in education, they are in preventing infections before they actually occur, right? And they mostly work for the council. That is the field of public health. Now, iyo mwachanda bachilufya yachira cha sound kwana kalimo community health assistants.
No, we have also public health nurses, and the jobs have been advertised. Like
they have been advertised by Munshya.
Are they members of the General Nursing Council of Zambia?
Yes, they are. They are.
They are nurses.
Yes, but when these adverts came, most of these jobs are in the rural areas.
But we should not forget that we have those who have just done public health degree.
Yeah, so those are different, but these are nurses. These are nurses. They are
those are nurses. The nurses, they can even work in the ward and all that.
They can even work in the. No, but qualified registered nursing.
Yes, but public health nurses are also registered general nurse. This one, there is registered general nurse. Ebengi abatumona abengi banas ngatoleranda niba registered general nurses.
Yes.
Elo kwaba a few nurses abachita specialize. Right? For example, kwaliba this not need to go. This not need to go.
No, I wanted to show. Okay.
So then, so there is the general nurses, then qualify a few nurses are specialized, others are known as public health nurses. They are a nurse, but they deal with public health. But they can still do general nursing. And then kwasaba psychiatric nurses. Niba nasi, but specialization yabo ni nursing.
Psychiatry.
And then kwasaba midwives. They are still nurses, but they've right? Nursing, midwife nursing. Now, I think later on, Kwalisava, another category of midwives, Abakobatema nurses, but ma midwives.
Midwifery, is it not a specialization?
No, it's a specialization, but also the government, I think, at one point trained midwives in their own right. I don't know what wisdom there was.
Then Munshya, the other concern abantu bakwete yakwebati abantu nga bachita apply, because people are still worried that there are still kerenkas in the system. Abantu bali amukushita apply for these jobs. It's a manual thing. Walemba application waya shaf. So there's no evidence that your application has been received and it has been sent. If it was done electronically.
No, but Patrick, that's not the way it is. The way, once you are dropping a letter to any institution, you need to ask for anything of evidence, kind of a death stamp.
People are not given that. People are not given that. I know people have applied who haven't been given that.
Yes, but they need to ask for that. And what they have been told is once you apply to the district, you need to the district medical officer. You need to also send a copy to the DC, just in case you come and say, I applied, but I was not picked and all that and blah, blah, such kind of a thing. Then they can follow up. If it was lost, then they can follow up from the DC's office and pull your file to say, yes, this person applied, what happened? So that's what is happening. For the province, it is also the same, where you apply to the permanent secretary, to the provincial medical officer, then you copy the provincial permanent secretary. This is what is happening. So there's a system, a deliberate system that has been put in place to show like it's doing a self-audit kind of.
But it's not electronic. It's physical.
But
it's not electronic.
But everything is physical until it's electronic. So once the district medical officers receive your application, they can either scan it or they can input the data to send it to whoever needs to look at it centrally. I have no sense there.
No, look now the way it is. Employment is not happening centrally. No, it has been decentralized. So what will happen is those applications that have been sent in a certain district, this district human resource committee, which comprises other people, they are going to sit and make recommendations. And those recommendations, they go to the provincial human resource selection committee. And that human resource committee from the province, the one that will also recommend and go to Lusaka. And it will go just like that. So that's the purpose of that. So if it was electronically, you would have said you apply centrally, but no, it is not centrally, because the way they have put, if you have been picked to work as a doctor in Rwanda, it means that you've been in Rwanda for the next 4 years. There will be no need of you working for 6 months that I want a transfer. No. It's very clear. You need to work there for 4 years. You serve those people in that particular district. Then you can leave to go to school and other places you want to go.
Yeah, but I think one of the strengths that this particular way of hiring is it will keep, because one of the reasons why it was difficult to keep people in rural areas was that hire kulusaka elo baba posta. This one is different. So because for you to make the trip from wherever you are, okuya ku Milenge, elo wachitira apply from Milenge, is that you are already connected with the land, and you are likely to stay there because eko lechitira apply. Na nkuntanshwa isa fichinja bakesa kuipshat iwe te kulusaka wachitira apply kwa Sokontwe. So number you watch the apply kwa Sokontwe and you expected to be stationed where? In Kabwata? No. You are stationed kwa Sokontwe. Eko wachitira apply kwa Sokontwe. It means then you are going to serve the people of Sokontwe. I think that's a very good strategy, and I commend them for doing that. If you want to keep people in rural areas, hire them from rural areas.
Yeah, but the question about Munshya is, there are not so many people trained in Sokontwe. A lot of people are trained in Lusaka and the Copper Belt. So, which means you'll be forcing people now to move from Lusaka and go and work in Sokontwe.
Which is wonderful. It is going to change. It's no longer kukalale. It's a reverse now, which is pretty good. Which means mwebali mu town mweba kuba mwalisambirira na degrees mwalikwata na diplomas na certificate from HPCZ mwalikwata. Now kulusaka, there is nothing for you. What is for you is kwa Sokontwe na kwa Milambo ku Milenge. That is where you now must go. So there is got to be reverse immigration. Instead of ukufuma kumushi mwaisa mukalale nomba bantu balafuma mukalale ukuya kumushi, which is pretty recommendable. That's what I would recommend.
I think one thing that we need to know and understand is people move from the village to go to Lusaka or Copper Belt for the purpose of education. And once they get educated, now they want jobs. They stay in Lusaka and Copper Belt because that's where jobs are. But now the jobs are going back to where they came from. So what will happen is they'll get the education from Copper Belt or Lusaka, but go again find the job where in the village where they came from. So which is a very good thing. You see, when you go actually to some nursing schools, rural nursing schools, the people are going to find in those rural nursing schools are people coming from Lusaka Copper Belt, not even the people from the rural themselves there, no, but from the entire Copper Belt and Lusaka. So that's why you find the people. So in terms of saying that they will run away, they will not run away. And so far, I've heard a lot of young people who are moving long distances to go and apply in these rural areas because they want to increase their chances of them being picked or employed by the government.
All right. So we are joined right now by Linda Banks of the Linda Banks Show on TVBAKWETU. Miss Banks,
Good
welcome.
evening. Thank you very much. How's everyone doing?
We are doing very well, and the issue here
Very
is
well.
that people. Oh, sorry. Mleba posha kanika.
Ah, nikajipushe kwa kanika chali kale. N'abatulufya.
Valinda, nimira ile chitiko lelo, nimira ko Wednesday, Tuesday lelo. Tamusango hapo pa program yesu tubafena ba Munshya na ba Jerome tulelaka. Mwamonekela kuisa ba mayo.
Mulishani mkwai chungulofu mkwai batulufya wese.
Awe shimpa ife kumilenge kuno.
Fantastic, that's nice. But Jerome mulishani kumilenge mulibakufi.
Now, the issue is that the topic. Oh, the topic is Ministry of Health. We understand that there were some indications that they could be re-advertised, but Jerome has disagreed. Namkanatsa kwa kabe re-advertising.
If you're feeling about Munshya, there will be no the advertisement. I think the people who quoted that, I think that came from Spring TV. They, I think, misquoted the minister. The minister mentioned to say, this is just an advert. It can be redone. She didn't say we are going to redo. As you know very well, the president also mentioned and he also said that the advert is out and this is what the way it is. So for anything to do with the advertisement and all that, you need to pass serious a lot of channels for it to be again, and they need to be serious memos for them to redo whatever. If the president was not involved, maybe if it was just on the ministerial area there, the minister would have said, yeah, it will be the advertised because the minister there, she's still the final say. But now it went beyond her. So which she doesn't want to look like insubordinating. No. So there is nothing of the advertisement. It's not here or there. That's fake news.
Okay. Minister of Health, Linda, what's your view?
Well, it's a mess, isn't it? I was actually just waiting for a response from Mr. Kawana just to confirm or refute the conversations I've been following for Mwashara Shimika. Minister of Health is such a mess, and it really needs some thorough washing. Especially like right now, the big thing obviously is the jobs that have been advertised or perhaps not. So we need clarity on what is happening, apart from the fact that there's a mess when it comes to medication, shortage of medication, and previously supply of drugs that are not fit for human consumption. So I think we just need to start right from the beginning, to be honest. And obviously, I've seen Jerome with the minister. Perhaps you could enlighten us as to what her step-by-step plans are to sorting this issue out. I know with the shortage of drugs, the government is very proactive. Mr. Kawana was inspecting the meds himself, and the president was there. So that is at hand. But Jerome, in regards to employment and getting rid of people who sort of were up to no good. How are things going so far?
No. But Jerome is not going to answer that because Jerome has no role, has no official role. So we are going to excuse
but
him.
Jerome knows why. Like because he has been with the minister. So now we're going news. But we don't about resident pharmacist. But akali mbusha, akali legitimate.
Okay.
Va Patrick na mona number 4 Friday fili Black Friday ka.
You know, Munshya, before Jerome comes in, remember last time Jerome Vaishre, Nalanjira Jerome, na chimimona na minister of health. That's the same thing, Linda Leland. So imo file mwaishiba, mweba sangwa na minister before Black Friday.
Yeah, I think over the issue of employment, I think the minister, she has been so much open and she has been very much straightforward concerning the issues of employment, and she has been very much transparent. And not only that, she has opened the door for everyone to go there and consult and ask and criticize where they feel like they can do. She is not chasing anybody. And when you check very well, you'll find that she has allowed all the profession bodies to go to her and also submit what they feel need to be done by the ministry. And this is an opportunity for the profession bodies that have been crying foul to say, we have not been considered for a longer period of time by the government, by the Ministry of Health. But this minister, she's saying, submit what you want us to do, and we are going to check and read what you have submitted. If we see that they are going to improve the health sector, we are going to adopt that. We don't mind where the submission is coming from. So that's
that's too general.
That's the
I think Minister of Health, we have a general issue, and then we have much more specific issues. Today's specific issue is the re-advertisement. Is it going on, or are they going to re-advertise or not? Is there
that's fake news, Munshya, that's fake news. So let's bury that. That's fake news. It's not here or there. So we cannot dwell on the advertisement where we have not heard it from the government. It's fake news. So maybe we talk more on the employment, the vacancies, maybe. Yeah. Because that's the thing the government has said.
We're waiting to hear from Mr. Kawana. He's pretty prompt at responding. Otherwise, to the case, then we can carry on with that conversation. Before Munshya, you come in. Sorry, I've just seen a message from someone who, let me just scroll back before you come in, sorry. From Laston Tembo says, Linda, it's been long, welcome back. Don't forget to congratulate Madam Miti on her appointment. Well, if you watched last night's program, you may have noticed I did, but just for the sake of honoring this, congratulations, a huge congratulations to Madam Laura Miti. Dr. Munshya.
All right, yeah. So she posted on Facebook and was asking whether she will now be executive director, commissioner, human rights commissioner, Laura Miti. We're extremely proud of her, and she's been in the field of human rights for a very long time, and we are hoping that she's going to serve our country very, very well. And we are honored as TVBAKWETU for her to appear on the Linda Banks show, which comes every Sunday, but yesterday it came on a Monday. So we are very, very happy that it was a very hot program yesterday that Linda had with the rest of the team. And so we are very happy about that. Now, one of the issues that I wanted to talk about concerns the field of psychology. The 11,276 jobs have provisions for what they are calling psychosocial counselors, and the qualification is a certificate. Now, I don't know whether when it says certificate,
Vamusha,
it means degree holders.
Vamusha, pause there. I'm just asking that I just cut my video, but I'll just remain on the audio so that I charge the phone a little bit.
No, you can do that. You can do that. We are live on TV. Eh?
Yeah, problems, eh?
This is what makes TVBAKWETU to be the best.
You're right, Jerome. There's no hypocrisy, Munshya. No hypocrisy.
Okay. Psychosocial counselors. Yeah. Now, that's what they're looking for. Now, when you look at the advert, you have no psychologists, and so that was one of the concerns personally that I had. I was hoping that we are going to get psychologists, the profession of psychologist, recognized, and honestly, to have nearly every health institution to have a psychologist, if not to create psychologists outside the hospitals, because sometimes putting psychologists at the hospital might not be the best, so maybe separately, so that people know that that's a separate profession and people can go there and have a chat with them. But of course, the new jobs don't have that, and I'm hoping that the Psychology Association of Zambia will do a little bit more of lobbying. It's because our country has very little knowledge about this profession. And even when I post about psychologists, they tell me psychosocial counselors, but psychosocial counselors cannot take the place of the psychologist profession. And we are hoping that the Psychology Association of Zambia and all of you people that have done psychology and are clinical psychologists, speak for your profession, lobby for your profession, and educate the country, because the country has no knowledge whatsoever. When you talk about psychologists, they point you in the direction of psychiatrists and mental health nurses. No. Mental health nurses, psychiatry, they use a very different model than what a psychologist would use. And so we need to have it recognized. Bachelor of Pojan.
Yeah, but Munshya, you 100% correct. I work for NHS, and every NHS establishment, they've got psychologists, clinical psychologists, and different types of psychologists. Say, Munshya, if I don't go to work for 6 months off sick, the day I'm coming back, I have to be checked by a psychologist before I start work. Different, different types of psychologists. They're very, very important. And I think Zambia needs them.
And of course, Zambia does train psychologists, because there's psychology degrees, and people go on to, in fact, have a master of psychology. And I think so far they've mainly been used as guidance counselors at schools.
Every government institution, Munshya, needs a psychologist.
Yeah,
even companies, they've got industrial psychologists.
Yeah. Yeah, so that is what we mean. And so 11,000 jobs, it's not enough to just say that you're going to have psychosocial counselors. Because the field of psychosocial counseling at certificate level started from the HIV/AIDS pandemic, where they were having quick 2-week and 3 weeks training, psychosocial training, to help equip our people with skills to counsel mostly HIV/AIDS problems. That's where the psychosocial certificate started from. I understand that there are now some programs in Lusaka and on the Copper Belt that are doing like a 6 months or a 1-year program in psychosocial counseling, but that is still insufficient training. to elevate it to a level of a clinical psychologist, in my opinion. I don't know whether anyone else has anything to say about that. Valinda.
Yeah, I think especially with the current situation in Zambia and the world, really, with the COVID pandemic, people are in a bit of a rut. Some people are in difficult situations mentally, financially, and that really brings people into a very difficult kind of mental state. We've seen how young people sadly are taking their own lives, so it's really important not to be pointing people to psychiatrists, and especially in Zambia, there's this stigma of being crazy, cuckoo, mad, or whatever you want to call it. So it's very important for the government to have, like you rightly said, for us to have psychologists who specialize in a different kind of science. Psychiatrists do something completely different. Psychosocial, as the two phrases, it's about, social mobility and looking at people, especially during the HIV sort of rise. So counseling people who are going to have their tests, so they've just discovered that they're HIV positive. By psychologists, it's really a very key field that needs to be recognized and respected. But just to say something on behalf of the government, obviously I'm not the government spokesperson, but they can't roll out every job at the same time. I believe there's going to be a time when other fields of science are going to be recognized and perhaps jobs are going to start rolling out.
Yes, indeed.
Should I come in?
The only issue is the presence, like during this time, we are not hearing from the Psychology Association of Zambia, and we are not even hearing from psychologists themselves.
Perhaps it's too early.
No. So I'm giving a challenge to psychologists. Speak about your profession, speak to the media about it, use social media, and explain exactly what your profession is all about, the people that are trained in psychology, and create interest from among citizens, young people that want to become psychologists as a legitimate health profession. You can't just leave it to psychosocial counselors and leave it and say that psychosocial counselors are going to fill the void. No, we need better training in counseling skills, and I think your degrees and your master's degrees they would help provide that guidance. And so the lack of media presence from psychologists is worrying. So come up and talk to the country. Let people know that this profession exists. That would be important.
Yeah, Munshya, just for me to come in, the reason why we have seen psychologists or people have done psychology not to be that much recognized is most of these courses are cross-cutting. You'll find that in the means of education they are needed, because there are schools which needs psychologists and all that. Yeah. Then you'll find that in the means of health, we also need the people who have done psychology. And you'll find maybe in another means, just like the way we mentioned concerning the issues of public health, we have people who have done public health degree. Now we don't know which ministry should they fall into. Is it health, or they should fall under the means of local government? Again, we have people who have done similar to public health, which is environmental health. These two are different professions. So these are some of the confusions that we need our people and the people from these professionals to explain to the public and highlight the differences.
You are a pharmacist, chemist, drug manufacturer, and your profession cuts across health as well as other things, right? because you've got
No,
pharmacists. No, just a second. You've got pharmacists and chemists that give medication, but there are others that are helping people in Mopani copper mines to mix chemicals that either help animals or help the manufacture of minerals, or just work in the lab, isn't it?
Chemical engineers.
Do you cease then to be cross-cutting across the Ministry of Mines, the Ministry of Education, because you are in health? You know what I mean?
Yeah, I get the point, but the thing which is here is, imagine we have the pharmacists who are in the Ministry of or who are now dealing, like, mixing the chemicals in the mining industry, and the pharmacists that you are found in the hospital. You'll find that even identifying ourselves much, if we first were identified with the mines, it will be very difficult again to us to penetrate and be more identified with the Ministry of Health. So
Yes,
that's where the big issue.
But you
is
know
with
very well, as a pharmacist, of delegitimizing that goes on in the health industry, delegitimizing other health professions. You as pharmacists, you've been a victim of this delegitimization yourselves. And had it not been for your, just wait, Jerome, had it not been for your hard work, most people would not even know that there is a profession of pharmacist that exists separate from a doctor. You realize that?
Yeah, I get the point.
The same work that has been done for pharmacists, what we are asking is that let psychologists also raise the profile of their health profession for other people to benefit as well. Right? But yeah, what you are saying is because psychology cuts across Ministry of Education and everything else, then we shouldn't what? We shouldn't raise their profile? Is that what you are suggesting?
Can I just come in, Dr. Munshya? I don't think Jerome was saying that we shouldn't raise their profile. I think the issue at hand here was these adverts that have come out, they don't seem to include psychologists. So the discussion at hand perhaps should be, in the next batch of roles or vacancies that come out, the government should consider this, because obviously you can't really put down one career over another. That is illogical. And psychologists, they don't only end up to go and work in the medical field, as we know. There's educational psychology, so in schools, in higher education institutions, there's industrial psychology. Most of these people, or my own sister actually did psychology, and she's working just in a parastatal organization. So they kind of just mingle into other careers, or some just evolve, they go and do further studies, masters, and then become clinical psychologists. But it takes several years, more years than actually doing a 7-year doctorate to become a clinical psychologist. So it's but it's important, you're right, it's important that perhaps those who've studied psychology at degree level should consider going to do a master's, then move on to a PhD to become a clinical psychologist. But I'm not sure Jerome said we shouldn't raise their profile, because I think it's really important to raise the profile of any career, really, so that young people are employed.
Yeah, let me first. I didn't say we should not raise their profile. They should do that. The issue which I was saying is, we have said the advert does not include more like the psychologist, and the reason I've said, just like the way the advert,
the advert actually does not include psychologists. It's not just a presupposition. This advert for health workers does not include psychologists.
Perhaps what we should be asking is why? Why?
Just like it does not include public health, those who have done public health degree. It's not there. There's no vacancy for such. But you discover that these are some of the positions or professions that are more, again, identified with another ministry. So now what they need now to do is to profile themselves more so that people start knowing that psychology is related with health. Public health is also more related with health matters as compared to leave it hanging where people need to guess. Where are we going to put the psychologists? Maybe this ministry or the other. They should profile that so that we know that psychologists are much needed in the health sector. Just like the public health, we also know, we should know that they are needed in the health sector. Or else we'll be saying, we have a nurse who has done public health, just get a nurse and leave the other person.
You know, because I think one of the things with professions, it's and health professions in particular, it's going to be a long night.
Chungulopo mkwai wa Munshya, chungulopo mkwai volinda vo chilofya wokanika. Thank you so much. Thank you so much. It's a good discussion, but my take on this issue, by the way, let me just say hello to my people from Western Province. Muchwa ni mambo mbwaliambai, lwata luto omboka kwa kuomboka, lumwanzila, luitumezi, and Livingstone, I hope mwiketile. Coming to the discussion, well, it's quite interesting, but you see, if we're Zambian, sometimes we always love to jump the gun, you know, just because somebody has come up with this recruitment, once to other professions that are not even mentioned. Yes, of course, they are very vital in our society. They are important. But for now, what is our main focus? Let's focus on what we can manage right now. Because do we have psychologists, even an association, if it's there? What has it done? So that's why it is imperative, of course, to talk about them so that they come to to start executing their profession, because we need them. And psychology, it's not just in health. Psychology, it's in all sectors of life. However, having said that, let us look at what this person or this government has done so far. The government has created, has employed, in short, has employed, is it 11,000?
11,276.
Exactly. And they have done adverts, and people have already started applying. And now, for people to start complaining about, 1, advertising, 2, processes, 3, complain. We have the government institutions. We have, if you need information, you know where to go. That's why so the thing is, you have to work. Huh? You have to let's inculcate this culture of reading. Let's read. Let's not just listen. Let's follow the right procedure. Kaviye ni ku Ministry of Information or kuma government gazette mwaya ipusha or newspaper. You follow the right procedure. The procedures are there tabulated. Ngana vasha profession yenu pa newspaper. It means it has not been mentioned yet. It will come probably in the future. For now, tulefwa yama nurses, tulefwa yama physiotherapist, tulefwa. That's what is happening. Now, of course, na ino endefwa kumona occupational therapist. We need all those things. We need all those kind of professions. But ingatawalipo. So why don't we just appreciate what we have been given? Tuletasha fema Zambia. Muno itumela. Muletasha. Not umuntu achita employer abantu 11,000 at yo na bachapo. No,
it's not 11,000. It's not 11,000. It is 11,276.
Exactly.
Yeah. Dr. Munshya, can I just
to borrow what Rufias will say, which government with the previous regimes that we've gone through, since Zambia is still in their 50s or 60, which government has ever come up with such kind of recruitment? This government, so this government so this government is doing something, and barely 7 months in the office, less than a year, they are showing you this, and then mwalaunfwa bambia bakalipa imitima wo awe
inenchito nishite mwamwe.
Some of us, we are happy.
Nderangira kufa ama psychologists,
yes,
ama clinical psychologists.
We need psychologists.
Clinical psychologists. Among the 11,276, just a second. Do we even have 100 clinical psychologists in Zambia? If we do,
probably not.
Can we manage to pay them?
We have some very important news coming in.
Yes. Volume.
Yeah, I've just received brand new information from the Office of the Filer.
Let him know.
In regards to the story that brought this conversation up. So apparently it's fake news. There's no such thing as re-advertised jobs. So they haven't re-advertised any jobs. And this is from the horse's mouth, as the Bazungus say, from the horse's mouth. So that was fake news.
Yeah.
Tabloid.
So no re-advertising.
No.
Bachishimba. There is no re-advertising of the jobs, contrary to speculation earlier.
It's fake news, like Linda has rightly put it. But before I proceed, let me greet everyone. Bomke labai, muchwani, mutazichwani. Changu. Ba Patrick Chukianga batishani vandu memkwai.
We future shimpa mwenkashi. Twalubila imwe mwewe na milenge.
Fwevo lesa letu sunga. Waluse.
Valinda kumbelesi.
That's fake news. I think we need to be very careful also.
I think
Nichi paka picture
napa fita
kakalight so apa shishengali kendolo ilipo so sorry
Majero palise mfi Majero
balishani mkwai
abachimba tulivyo bino kwenda
ole sapale mamule bomba imwe ni mamwa bomba imwe na wabonza balipa programming ni mamwa abomba imwe mama kuira kulateka
eva teke chalo
ata
ina MOH eva teke chalo sai
mwapo kuira kulateka
But what Jacqueline? Tuleteka.
We
are the one taking.
Nangu kiba PF bare shova. Tadi ni fwe shova.
Pantu ni fwe tuleteka.
Bare shova tule ingishe nchito.
Ba mwelupwa ili ashia ku Ministry of Health ya related sansa. ilo limo mwebasambirira nga mulelanda insanse y'omulelanda poimwe taichilile ulio waikala 5 years achite graduate nurse clinical officer vajero mali yeshi pamali ashaya tatala bombapo. You can imagine insansa fe yamufyashi ukuishi bafyati umwana wachite graduate 5 years ago akengile nchito ilo omuntu fe kwena eseme atampe nokubika po amarumas ati no readvertising. I mean nibo satana bwa msango shanyu ubo ubwako bati mulefu afe okuleta enfulunga nyopa abefisuma. You know, I'm sorry, I'll take you back. Problem to akwete na ba PF is ibalete mokuchite fibisa na ifya bushetani chako bati abantu bamo na abafiro okufuma mofye muri bamoni ati fisuma na fyambo okuchitika. You put it right, which government has employed at such a rate in such a short time in a sector that is very cardinal to human life? The UPND is the first. Surely any good meaning Zambian should stand up and applaud. Pantu abakashana bamo tulelanda bali amaneses balifwa depression abalumendo balifwa bamo kutuwa msange fina lesha pamarket asakwati na alikwata diploma ninenes. I'm even registered, but government was not employing.
Yeah.
Mwalimu na hao bana mayo na bashitata bapite ne muri fya bana bayerembesha kwa application. We need to applaud. Ama clinical psychologists, I think, you know, just to advise, if I were in some of these offices, co-health, and even to the minister, I would suggest baichite advertise yeka. Aba icheko bali. Naba lumendo. But mom kasanga their diploma level, yes, at degree level there could be few, but we have a lot diploma level. And we need them also because depression is very high in the country, suicide cases are very high, GBV is very high.
And loss of elections is very high.
What you've got syphilis.
No.
Hello, banyina pakumukalipira basamu but syphilis. Depression.
Nenkongole ba Jacqueline. Inkongole abantu date.
At no kulusa my elections. Jacqueline, no kulusa my elections. Na kwena baba psychologist.
No, yes. But you see, our young children, our youths were so disadvantaged that some of them rendered themselves vulnerable and indulged carelessly. STIs are very high right now, but Jerome, bear me witness. So moi chenga bayamo na fekuchipatala ba doctor iwana ulwala syphilis. In the next 7 days, if we don't put you on medication, you are gone. Do you know that immediately their whole psychology, their whole system goes to the left? Now, if there's a clinical psychologist, muli balaba fuere ilia dust coat Dr. Shania White. Elo muli bayampanda mano, bamukalipirako, bamwebako, bamuchina ku brain. Before tabalambika na pa medication. No mbabanga tatubakwete. Chala bashani kubaiche. Later alone, later ni bashitata, aba retirement, aba poserenda lama kuli girlfriend ya retirement. Babula kuna malwele, elo baisa kuchipatala. I mean, these are issues on the ground.
That's true.
Yes, bali ba depressed, bashe bakwenda ko kuli bana mayo bali na 30 years bana kangwa na bobakana. Walire kuli majori, ko kuine kafueni pamo. Mwamona? Napera na totela.
Those are issues at Valinda Mwasuminisha. Those are issues that we hear every day.
Real issues.
Also drug addiction and alcohol abuse in the youths.
Yeah. And so you agree with me, Kanshi. Mwamona, mwachimpera a very hard time, bonse. Number you agree with me that we need clinical psychologists. So the Minister of Health, we know that you are receiving a lot of pressure from pharmacists. I'm a pharmacist. They are putting a lot of pressure on you, Jerome Kanika, Shan Yugo. And so you might just be looking at pharmacists. No. Muchsteko employ a clinical psychologists. In fact, most of them are in private practice, but utuma office, utuma private companies in Lusaka. You know, so that they continue working. We've got to end here.
But Munshya, sorry, before Tamlai, another thing, our people need to be taught. I'm thinking about forward psychologists. That's another challenge we have.
It's not psychiatrist.
Go and see a psychiatrist or a psychologist. The next question they'll tell you is, are you saying I'm mad? Are you saying nimpena? So I think we need to start educating Abantu. Look, what is psychology and why do we need these clinical psychologists? And how will they help our people? Thank you.
I think we've got to pick another day when we can talk about this with a registered clinical psychologist in Zambia, so that we can clarify some of these issues.
Munshya mwilava kushaka ka preamble kandi ka humble pray is that the reason why we want a psychologist to come in Zambia is to help our colleagues on the other side, those that lost terribly the elections, so that at least you can see what they are doing. They are damaging. They are not well. We need our brothers and sisters need help. They need the psychological help from our psychologists. So therefore, today Lombaba minister to include at least 3 or 4. I know they're highly educated and well paid. They need to be paid, of course, according to their education. But those who lost elections, that's why they are hurting right now. They are not seeing the good things that the government, are doing. So they need a psychological help. I thought that's my submission.
Wolinda, Mwasumina.
Nasumina, but I want to go back to the importance of what Jacqueline said. These are very critical issues. We may joke about them, but there's nothing funny about this. I personally have got family members who have gone through some of the things that we've all itemized. Young people abusing alcohol and drugs, they need serious help, urgent help. So I don't want to take the importance away from the major thing that has come out of this. So if the government can do the needful, Ministry of Health, advertise those very critical jobs, and also education, it always takes us back to education. Systematic educating our people, telling them psychologist, for goodness sake, it does not mean that you are crazy. And also ukubafunda for mumishi, like problem, seek help. We've got this thing like in Britain, the stiff upper lip, problems share because ask for help. It's very important. This is why, sadly, suicide rates are so high, because people feel they can't ask for help. I submit.
This has been a presentation of TVBAKWETU. Elias Munshya here with our friends Linda Banks from the Linda Banks Show on TVBAKWETU, Mr. Patrick Chilufya, Ms. Jacqueline Chishimba, Bo Mukelabai, and pharmacist Jerome Kanika. Good night, God bless you, and God bless our country. We'll see you tomorrow for the Mabeta show with Honorable Mabeta. Good night.
Good night.